You might see a question on the ballot this year that would set patient assignment limits for nurses. 22 News State House reporter Alicia Machado live in Boston with what those changes on the ballot question could bring.
The ballot question calls for the state to set limits on how many patients a nurse can care for at one time, from as little as one patient to as many as 6 at a time. Registered nurses said they're being forced by hospitals to care for too many patients at once. They're pushing for Massachusetts to set statewide patient assignment limits, an issue you could see on the 2018 ballot.
You should be able to get the same standard of care no matter what hospital you go to within the state.
If the ballot question is approved by voters, nurses could only care for one patient if they are under anesthesia, in intensive care, or in maternal child care with medical complications. Nurses could care for up to 5 patients if those patients are in non-urgent stable condition or rehabilitation. But the bill is facing opposition from some healthcare providers who think the restriction could be costly and take away hospital flexibility.
Rigid nurse staffing ratios decided by government mandates aren't the answer to this. We want hospitals to be able to decide and have the flexibility to decide their staffing.
Opponents believe the mandate could prevent hospitals from being able to move nurses around during emergencies and that it could hurt community hospitals. The legislature will review the petition in the coming months and could choose to approve it. If they don't, the campaign will have to gather another round of signatures before it can make it onto the ballot. Live at the State House in Boston, Alicia Machado for 22 News.